Hello and welcome. This video will discuss CMS's Cognitive Assessment and Care Services. Part 1. What are the Cognitive Assessment and Care Plan Services? All information contained within this video is current as of October 2021. Are you aware that over 16 million people in America are currently living with cognitive impairment? Did you know that an estimated 6.2 million adults in the United States aged 65 and older have Alzheimer's disease, the most common type of dementia? Cognitive impairment can impact everyday activities for your patient. This is why it is crucial to recognize the early signs and symptoms of cognitive impairment and to implement measures to prevent or reverse further cognitive decline before the condition advances. So, what is cognitive impairment? Cognition is the brain's ability to learn data, recall information, and make decisions. When cognitive impairment is present, the affected person has difficulty learning new information, remembering or recalling previously learned items, and using judgment during decision-making. Cognitive impairment can range from only mild impairment, where the person can still carry on everyday activities with little to no difficulty, to severe impairment, where the person is unable to perform everyday activities needed to function independently. How do you recognize if your patient has cognitive impairment? Some common signs and symptoms include memory loss and confusion, disorientation, difficulty recognizing familiar people or items, getting lost when in familiar places, impaired judgment-making skills, asking repetitive questions, often repeating the same information or stories, forgetting important dates such as a family member's birthday, mood swings, avoiding or withdrawing from social contact. When should you assess for cognitive impairment? A required component of both the initial and subsequent annual wellness visit is to detect for cognitive impairments. However, you can assess for cognitive impairment during any routine visit through direct observation, including data collection via interviews with your patient, family, caregivers, friends, etc. You may also consider administering a brief cognitive test. Pay attention to other factors that may influence your patient's cognitive functioning, including chronic medical conditions and health disparities. If your patient shows signs of cognitive impairment during an AWV or other routine visit, Medicare covers a separate visit to perform a more comprehensive assessment of your patient's cognitive function and develop a care plan. Who can perform cognitive assessment and care plan services? This service can be performed by any healthcare provider that is eligible to report evaluation and management services such as physicians, nurse practitioners, clinical nurse specialists, and physician assistants. Where can the cognitive assessment and care plan services be performed? It can be performed in an office or outpatient setting, in a private residence, at a care facility, at a rest home, or through telehealth services. Remember, detection for cognitive impairment is a required component of your patient's AWV. If you detect a cognitive impairment during an AWV or other routine visit, Medicare covers a separate visit for you to perform a more comprehensive cognitive assessment and develop a care plan for your patient. Performing these services allows you to address potential cognitive impairments in your patients, diagnose dementia or other related conditions, and develop approaches to assist your patients. Thank you for watching this video on Cognitive Assessment and Care Plan Services. For further information about the Cognitive Assessment and Care Plan Services, please refer to the Cognitive Assessment and Care Plan Services webpage on the CMS website at www.cms.gov/cognitive.